Hey guys, you're welcome to my channel. In this channel, we're devoted to bringing to you vital health information that help you stay healthy at all times. Today, we'll be talking about what endometriosis really is, the symptoms, the causes, and how it could be managed. And don't forget at the end of this video to like and subscribe to this channel so that you can constantly get notified each time we drop a new video. Now let's get started. What is endometriosis? Endometriosis is a painful condition that can impact your everyday life. When you have endometriosis, this tissue similar to the lining of the uterus grows in other places within your abdomen and pelvic areas. Endometriosis can cause painful and heavy periods as well as fertility issues. The endometrium is the inner lining of your uterus. This tissue is what you share during the menstrual period. Think of endometrium as layers of tissue that build up along the inside lining of your uterus. When you have a period, those layers fall away from the walls of your uterus and leave your body. If you get pregnant, the endometrium helps support the early phase of its development. When you have endometriosis, endometrial-like tissues grows on other organs or structure, and this tissue can grow within your abdomen and the pelvis or even the chest. This is hormonally sensitive and can become inflamed during your menstrual cycle. These areas of endometrial-like tissue can cause ovarian cysts, superficial lesions, deeper nodules, adhesions, and scar tissue within the body. A few places you can develop endometriosis include the outside and back of your uterus, the fallopian tubes, the ovaries, the vagina, the peritoneal cavity, the pelvis, the bladder and ureters, the intestines and rectum, and lastly, the diaphragm. How serious is endometriosis? Endometriosis is a common condition that can interfere with your everyday life. It can cause long-term pain, disruptions to your menstrual cycle, and fertility issues. The symptoms of endometriosis are often manageable with treatment. Then who can get endometriosis? Endometriosis is a condition that most commonly impacts people between the ages of 25 and 40 years. It can also happen to younger people during their teenage years, although many people find relief from endometriosis symptoms after menopause. It can still cause discomfort and pain. What are the risk factors for endometriosis? There are some factors that can place you at a higher risk of developing endometriosis. These factors can include family history of endometriosis, the age you first start having periods. People who get menstruating before age 11 may be at higher risk. The length of your menstrual cycle and duration of flow. Defects in your uterus or fallopian tubes. Is endometriosis genetic? Although experts don't know the exact cause of endometriosis, they do see a connection between a family history of the condition and an increased risk of developing it at some point. If another person in your family, your mother, your grandmother, or sister has endometriosis, talk to your health care provider about your risk. Symptoms and causes. The cause of endometriosis is unknown. When you have endometriosis, tissue similar to the lining of your uterus grows in the lining or in the wrong place. When it develops in places like the outside of your uterus, fallopian tubes, ovary, intestines, and within the pelvic cavity, it can cause painful symptoms. This pain related to increased inflammation and often fibrosis and adhesions. This endometrial-like tissue growing outside your uterus can cause scar tissue. And this section of scar tissue can fuse your organs together, creating connections between them that normally wouldn't be there. This can lead to discomfort and pain. Symptoms of endometriosis. There are many symptoms connected with endometriosis. The main symptoms is pain. This pain can be intense or mild. It can typically be felt in your abdomen, the pelvic region, and lower back. Although endometriosis is a common condition, not all people will experience symptoms. Sometimes you can have endometriosis and not know until it's found during another procedure or investigation of infertility. People who do experience symptoms of endometriosis may have very painful menstrual cramps, abdominal pain, or low back stabbing pain during your periods or in between periods, pain during sex, heavy bleeding during period or spotting between periods, infertility, and painful bowel movements. How is endometriosis diagnosed? In many cases, an endometriosis diagnosis will start with your symptoms. Painful and heavy periods might cause you to reach out to your healthcare provider. Once at an appointment, your physician may start by asking you for personal medical history about your previous pregnancies and if any other people in your family has endometriosis. Also, your health care provider may request for the following for detailed information and correct diagnosis. 1. Pelvic ultrasound, MRI. Laparoscopy may be offered for both definitive diagnosis and treatment. A biopsy, that is, a small tissue sample, might be taken during this procedure, which is sent to the lab to confirm diagnosis. Management of endometriosis. Your health care provider will help create your treatment plan for endometriosis based on few factors, which include the severity of your condition, your plan for future pregnancies, the severity of your symptoms, which is most often pain. In many cases, your treatment plan will focus primarily on managing your pain and improving fertility issues. This can be done through medications and surgery. Prevention. Endometriosis isn't a condition you can necessarily prevent. However, there are certain factors that can reduce your risk of developing the condition. But in some cases, you may still have endometriosis. A few factors that can reduce your risk of endometriosis include pregnancy, breastfeeding, maintaining a healthy weight, starting your menstruation at a later age, complications of endometriosis. People with endometriosis may experience fertility issues, bowel or bladder issues, which might include pain with voiding or with bowel movement, or seeing blood in urine or stool. Severe ureter endometriosis can occasionally get the kidney swollen, impact the lung or diaphragm, which leads to shortness of breath, chest pain, or lung collapse during menstrual cycle. Thank you for listening.